Hello, everyone. It's Dr. Neerapandia. A lot of Golden State Warriors fans have questions about core muscle injuries after hearing the report of Gary Payton II yesterday. Here's a quick breakdown of core muscle injuries, what surgical treatment entails, and what the outcomes are for NBA players. And the first important thing to understand is what are the functions of the core muscles. So the core muscles are a series of muscles in the abdomen and hip region that basically help to stabilize the trunk. So in general, if you have compromise of these muscles, it can be very hard to do explosive twisting activities. In addition, if you have compromise of these muscles, you place a lot more load on the lower extremities because your trunk is not stabilized, which can potentially lead to injury down there. Now, when athletes have core muscle injuries, typically rehab is the first course of treatment. But if athletes continue to have pain or have a particular type of injury to the core muscles, they may require surgery. Now, what surgery typically entails for core muscle issues is basically sewing the tendons back to bone where the core muscles or these sports hernia muscles have basically been injured. Now, if you look at this model of the pelvis, typically where those muscles will attach for the abdomen or the core will be kind of right in this area right over here, or in this area over the pelvis. And typically once done during the surgeries, those muscles, the tendons, are basically repaired back to bone. Now, in general, if you look at outcomes in NBA players, about 90% of NBA players will return to play, and the average return to play is somewhere between 4 to 5 months. If you look at performance metrics, the first season back, most players will have a decrease in minutes played as well as their overall statistics. These statistical issues will basically resolve by year 3. Now, if you look at athletes who have the surgery, there will be a subset who continue to have pain. Now, the important thing to understand is only the Golden State Warriors and the Portland Trail Blazers know the exact reasons why Gary Payton II may have failed his physical and how this is in relation to his core muscle injury. But if you look at patients in general, there are a couple of different reasons for why they may continue to have pain. Number one, they simply may just be weak in that area after surgery, particularly if they had the injury for a long period of time. In these cases, you simply need rehab to basically get the area stronger so you can do your twisting explosive movements as well as take strain off your lower extremities. Number two, sometimes the repair may not have actually taken. This is very rare, particularly since you know that 90% of NBA players will get back to play, and you see similar return to play rates in NFL players as well too. Number three, sometimes there can be residual nerve irritation. So there's a nerve on the inside part of the thigh called the inguinal nerve. Sometimes that can be a continued source of pain after this injury. And number four, sometimes there can be continued issues with the adductor muscles, where the adductor tendon, which is basically it attaches to the inside part of the pelvis, continues to be a source of pain. Now, in general, a lot of these athletes who have this surgery may continue to have pain, may need a secondary procedure, or may simply need rehab. We don't know the exact reasons why Gary Payton II failed his physical, but there in general are some reasons why an athlete may continue to have pain. In addition, there are some questions about Toradol and what exactly is this medication, as was reported yesterday. In general, Toradol is an anti-inflammatory medication that is very strong that is injected for pain relief. Now, typically it's used in small doses, sometimes after surgery, for athletes who are having pain. But there's been a lot of scrutiny of the use of this medication, particularly in NFL, because in general, this medication, because it is a strong anti-inflammatory, can have risks of bleeding, stomach issues, as well as kidney issues. Now, in general, we hope that Gary Payton II has a strong recovery and is able to return back with the Warriors. But the good news is that in general, for athletes who have these injuries, even those who have a little bit of a longer course, the vast majority of them will return to play and have good, healthy careers. Thank you.